Hey everyone, Luke here with the Joint Replacement Therapist. Today I wanted to share another video talking about deadlift technique and some things to keep in mind if you're someone who's preparing for surgery or rehabbing after surgery, some tips for performing deadlifts. And like I always say, deadlifts is not something to be afraid of. They're actually really great exercises that provide a lot of benefits as long as they're done with good technique and good supervision. So I talked a little bit about your feet and your leg position with performing the deadlift. And now I want to talk a little bit about the upper body. So starting with the arms. So the arms are actually acting in a passive manner more or less. So you think of the arms almost as a rope that's holding the weight for us. They're not doing any of the work. So the arms should be extended out straight with the elbows straight, and there shouldn't be any bending of the elbows. You don't want any work coming from the biceps. It should all be coming from the legs. You can have kind of two positions of the arms. Most cases you're going to have arms in nice and close to your body, a little bit past shoulder width. Sometimes people will also do this wider grip deadlift, which is when you might be training for something such as Olympic lift, doing a snatch movement. But for our purposes, arms nice and close to the legs, a little bit of shoulder width apart is perfect. And you're going to grip the bar or the kettlebell or whatever it may be all the way around with a closed grip. Shoulders, you want your chest up and out, and what that's going to do is help maintain that neutral spine. So if you bring the shoulders down, you're going to start to curl down, be in that flex position that we don't want. So trying to keep the chest up and out is going to help maintain that more neutral spine position. For your shoulders, you want the shoulders over the barbell or whatever the object is you're doing the deadlift with, or you want them a little bit ahead is okay too. So arms straight, hands a little bit past shoulder width apart, chest up and out, shoulders over the barbell or a little forward, and you're in a good position to begin your deadlift. Thank you very much. Have a great day.